While researching this documentary, I read Dr. Lawrence Broxmeyer's Parkinson's Another Look. Through the investigation of medical history and clinical studies, Dr. Broxmeyer states that Parkinson's is caused by a bacteria, the Mycobacterium tuberculosis. Dr. Broxmeyer thinks the tubercular germ behind Parkinson's is not always classical tuberculosis, but can also be an atypical tuberculosis, possibly as a result of interbreeding with either members of its mycobacterial family, such as fowl tuberculosis, Mycobacterium avium, or possibly with microbes from its larger order, which includes Nocardia and Carinibacteria. When either event occurs, atypical strains of tuberculosis emerge. Tuberculosis is in itself a known nerve-seeking disease, and Broxmeyer feels that it, and strains of it, can cause Parkinson's. Atypical mycobacterial infections are non-tubercular, and result from coming into contact with bacteria from common environmental sources, such as water, soil, and food. From 1750 to 1950, it is estimated that TB killed 1 billion people. 1/3 of the world's population is currently infected with latent tuberculosis, and 5 to 10% of those infected with latent TB acquire active infections. Mycobacterium tuberculosis is a particularly deadly bacteria because it has both bacterial and fungal properties. TB is an airborne disease. The bacteria is spread from a person with active TB through talking, singing, laughing, coughing, spitting, and sneezing, and is then inhaled into the lungs of another person. In 2011, over 72,000 cases of TB were reported in the European Union, and 78% had pulmonary or lung tuberculosis. When TB affects other parts of the body, it is called extrapulmonary tuberculosis. The BCG is the tuberculosis vaccine. The BCG is prepared from weakened, attenuated live bovine tuberculosis bacillus, the Mycobacterium bovis, that has lost its virulence. The BCG is from 0 to 80% effective in preventing tuberculosis. The substantia nigra's dark substance is neuromelanin and is pigmented with iron. Dopamine, itself toxic to catecholamine cells, is derived from tyrosine, and hydrogen peroxide is a product of dopamine. When hydrogen peroxide comes into contact with iron, free hydroxyl radicals are released and thus stress the substantia nigra. Tyrosine, dopamine, hydrogen peroxide, and free radical byproducts are all manufactured by mycobacterial intermediary metabolism and cell respiration. Formation of malondialdehyde, a free radical, in tuberculosis patients does occur when tubercle bacilli induces reactive oxygen species as a result of phagocytic respiratory burst. Whenever phagocytosis by activated macrophages fail, hydrogen peroxide is released. In this study, mean values of malondialdehyde was significantly higher in various TB cases when compared to controls. Malondialdehyde, MDA, and Parkinson's disease studies date back to the 1980s, and like many elements of Parkinson's disease, the results have been inconsistent. In 1989, levels of MDA were increased in Parkinsonian brains as compared to controls. In 1995, there was no significant elevation of serum MDA in Parkinson's disease patients as compared to controls. In 2000, 2 urine assays gave higher MDA levels than controls. In 2006, MDA content of cerebral spinal fluid was not significantly altered as compared to controls. In 2009, there was a significant difference between plasma MDA levels in Parkinson's disease patients and controls. In 2011, blood tests from Indian patients with PARK2 mutations had significantly increased MDA levels as compared to control subjects. In 2014, red blood cells had reduced superoxide dismutase activity and increased MDA levels. In 2017, serum MDA and superoxide dismutase activities in Parkinson's disease patients were not significantly different than controls. In the year 2000 urine MDA test, the authors state, "We measured MDA in the urine because the MDA in the blood is quickly cleared from the body by the kidneys, and the urine becomes a body fluid where the MDA is concentrated." Online there are multiple patents for urine MDA tests, including a do-it-yourself home test. The two other selected studies involved testing the brain and cerebral spinal fluid for MDA. In a Russian study entitled Metabolism of Lipid Peroxidation Products in Multiple Sclerosis Patients, the authors found no MDA in the cerebral spinal fluid of multiple sclerosis patients, while its blood level exceeded normal by 1.5 to 2 times. After hormonal therapy, the situation was found to be reversed. MDA appeared in the cerebral spinal fluid while the serum level dropped. Mycobacterium tuberculosis has a propensity to cause endothelial inflammation and disease, and that leads to stroke as well as hydrocephalus, both stroke and hydrocephalus being well-established causes of Parkinson's. Preclinical work shows that tiny, so-called silent strokes in various areas of the brain may lead to inflammation that causes dopamine neurons to die, leading to Parkinson's. This explains why some people who are outwardly healthy may develop Parkinson's disease. Epsilon, when administered before, during, and after MPTP injections, prevents both neuronal loss and clinical symptoms in a primate MPTP model of Parkinson's disease. The stroke medication Epsilon inhibits proteins essential for bacteria to make new DNA, and targets multi-drug resistant bacteria, such as Mycobacterium tuberculosis and Helicobacter pylori. The catecholomethyltransferase inhibitor, which acts as a dopamine booster, Compton, the active ingredient of entacapone, interferes with the TB bacillus in computer models and was confirmed in lab dishes. UC Davis researcher Dr. Blaine Beeman attempted to prove the hypothesis that Nocardia asteroides, bacteria in the same order as Mycobacterium tuberculosis, actinomycetales, is the cause of Parkinson's disease. All bacteria have a layer of the polymer-like substance peptidoglycan in their cell wall. If peptidoglycan is located on the exterior of the cell wall, when stained with the dye crystal violet, it stains a bluish purple and is categorized as gram-positive. Mycobacterium tuberculosis, though it has been classified as gram-positive, when it is stained, it stains gram-indeterminate. Nocardia species stain weakly gram-positive. The cell wall of M. tuberculosis is high in mycolic acid and stains pink with carbofuchsin dye, and is categorized as acid-fast. Mycolic acid is unique to Mycobacteria. When stained with carbofuchsin dye, Nocardia asteroides are partially acid-fast. Doctors Kobata and Shimokawa detected antibodies of Nocardia-related organisms in 20 of 20 patients with Parkinson's disease. The authors acknowledged that the results could also signify previous infection with tuberculosis. Using tuberculosis like Nocardia, Beeman documented that within 10 to 14 days after inoculation of Nocardia asteroides, mice developed movement and behavioral disorders, many of which mimicked Parkinson's. Moreover, in 10% of his mice, a full-blown classic L-DOPA-responsive, tremulous, hypoactive, stooped posture Parkinson's developed. Even the substantia was involved. Kobata now speculated that it was not the typical rod-shaped Nocardia that brought on Parkinson's, but its coxoid or round-shaped L forms. L forms are cell wall defective or deficient forms of bacteria capable of reverting back to their classical parent forms. In his experiments, Dr. Beeman discovered once Nocardia induces Parkinsonism, it disappears. That means we cannot expect to find bacteria in Parkinson's patients, and so confirm our theory. Rhodococcus is a genus of aerobic gram-positive bacteria, closely related to Mycobacterium and Corynebacterium. Mice injected with Rhodococcus aurantiacus by the intravenous route show neurological disorders, hemiparesis, vertical headshake, and turnaround gait after 7-day post-infection. Neurological symptoms by IV inoculation of Rhodococcus aurantiacus were relieved by treatment with levodopa. Rhodococcus aurantiacus was isolated from the brain and was found to be completely eliminated at day 7 post-infection. Kobata reported that a movement disorder was observed after the elimination of Nocardia. We also observed movement disorders in mice infected with Rhodococcus aurantiacus. Rhodococcus aurantiacus is closely related to the genera Nocardia. Dr. Broxmeyer references bacteriologists Virginia Livingston and Eleanor Alexander Jackson, who isolated Mycobacterium-like microorganisms in 2 cases of Wilson's disease, a 7-year-old boy and a 34-year-old woman. After injecting the isolated bacteria into mice and guinea pigs, the animals had chronic disease of the liver, spleen, and brain, the same symptoms as the 2 Wilson's patients. The acid-fast forms resembled Mycobacteria from Hansen's disease, Mycobacterium leprae, and intracellular granulomatous nocardiosis. It is further suggested that the biochemical changes observed in Wilson's disease may be secondary to the infective process. A similar microorganism has been cultured recently from the blood of a 3rd case, a patient at the Rockefeller Institute Hospital in New York. Wilson's disease is a genetic copper-hoarding disease, but it should be noted that acid-fast forms can cause chromosomal damage and genetic changes. Mycobacterium leprae, the bacteria which causes lepracy, invades Schwann cells, cells that insulate peripheral nerve cells, then turns off the genes that give Schwann cells their characteristics. M. leprae then activates another set of genes and transforms them into neural crest stem cells. M. leprae then hide inside the very mobile stem cells and spread infection throughout the body. The frequency of chromosomal aberrations was significantly higher in tuberculosis patients compared to controls. These findings suggest that the tubercle bacillus might be capable of inducing chromosome damage. Also, Wilson's disease changes in methionine metabolism and inflammation affect global DNA methylation in early liver disease. Mycobacterium tuberculosis can cause DNA methylation. For example, DNA methylation impacts gene expression and ensures hypoxic survival of Mycobacterium tuberculosis. Unraveling methylation changes of host macrophages in Mycobacterium tuberculosis infection, and Understanding the host epigenetics in Mycobacterium tuberculosis infection. The manganese chelator PAS was introduced in 1948 as an antibiotic to treat tuberculosis. It is now considered a second-line TB drug and is only used to treat multi-drug-resistant tuberculosis. PAS inhibits the conversion of salicylate to mycobactin and targets M. tuberculosis iron acquisition. Supplementation of iron and/or DFO, the iron chelator, to mycobacteria in a lab dish resulted in iron supplementation enhanced intra and extracellular growth of Mycobacterium tuberculosis and BCG. Chelation with DFO prevented the enhanced replication of mycobacteria promoted by iron. Increased iron levels have been observed in the areas of the brain that are affected by Parkinson's disease. Yet, low iron levels in the blood, anemia, have been associated with increased risk of Parkinson's disease. This study confirms that iron imbalance exists in tuberculosis patients, and is the first to show that too little or too much iron may contribute to poor clinical outcomes. When manganese, copper, or iron are added to an appropriate TB culture medium, they drastically increase mycobacterial cell mass. The BCG, the Bacillus calmette-guerin, is the tuberculosis vaccine. The BCG vaccine has been shown to be neuroprotective in the MPTP mouse model of Parkinson's disease. The BCG stimulates T cell production, and the amount of T cells were correlated with striatal dopamine levels and dopamine transporter binding. A bacteriophage is a virus that infects and replicates within bacteria. It is well established that phage-encoded toxins contribute to the virulence of a variety of bacterial pathogens, including Escherichia coli, Salmonella species, Corynebacterium diphtheria, and Vibrio cholera. Phages inside mycobacteria can be activated by a host of chemical and other agents, some pesticide-like. Some mycobacteriophages in cluster D do encode a vegetative insecticidal protein like insect toxin genes that could confer virulence to a bacterial host, although it is unclear what the host might be, or what it might infect. Contact with pesticides is a known risk factor for Parkinson's disease. Italian researchers performed a meta-analysis of prior Parkinson's pesticide studies and concluded the risk factor was 80%. The authors support the hypothesis that a causative agent in Parkinson's disease might be either a fungus or bacteria with fungus-like properties, actinobacteria, and that their spores may serve as infectious agents. Similar to that seen in patients given intensive antibacterial medication, the use of herbicides and insecticides could indirectly increase the amount of fungi and actinobacteria. Furthermore, actinomycetes have considerable potential for the biotransformation and biodegradation of pesticides, and co-metabolism of pesticides is frequently observed within this group of bacteria. Evaluation of updated available information are all consistent with the hypothesis that Parkinson's disease may be induced by spores from fungi or actinobacteria, and thus supports Broxmeyer's hypothesis put forth 15 years ago. Corynebacterium diphtheria, the bacteria which causes diphtheria, is in the same order as M. tuberculosis, actinomycetales. Martin and Osmond found Parkinson's linked more to early diphtheria than with control studies. Corynebacteria diphtheria, long associated with Parkinson's, is closely related to Mycobacteria, sharing many properties and even exchanging genetic material through common phage transfer. Heat shock proteins are a group of proteins induced by heat shock, an increase of bodily temperature from various sources, such as infection, temperatures ranging from approximately 100 to 106 degrees Fahrenheit. Gao and Raynell linked Parkinson's to Mycobacteria in blood diagnostic heat shock proteins. Polish researchers investigated heat shock proteins in Parkinson's disease patients versus a control group of old and young volunteers with non-inflammatory neurological disorders and blood donors. Using recombinant mycobacterial heat shock proteins 65 and 70, antibodies were found to be significantly greater in Parkinson's disease patients than controls. Increased heat shock protein expression, which is induced by stress, provides cells with protection against environmental insults. Alternatively, the antibodies may be present as a consequence of prior infections. The following doctors found tuberculosis in patients with symptomatic Parkinson's. The following doctors cured symptomatic Parkinson's in TB patients with tuberculosis antibiotics. In 1893, the World's Fair was held in Chicago. The exposition included carnival rides and the first Ferris wheel. Edward Muybridge used his zoopraxiscope to show moving pictures to a paying public. The hall was the first commercial movie theater. In 1893, Drs. Bloch and Marinesco established that substantia nigra is important to Parkinson's through an autopsy of a tuberculosis patient. During autopsy, they found a tuberculoma in the substantia nigra of a 38-year-old, and established that when the substantia nigra is damaged, it would lead to Parkinson's. Dr. Joseph Knoll originally developed the MAO inhibitor Depronel to treat depression. The use of Depronel to treat Parkinson's is considered off-label use. The first antidepressant drug was the MAO inhibitor iproniazid, and iproniazid was originally developed to treat tuberculosis. Iproniazid enhanced moods of TB patients, and in 1952 it was shown to improve depression in 2/3 of patients tested. The term antidepressant was first used in 1952. St. John's wort is an MAO-B inhibitor. A 2009 Spanish study concluded St. John's wort has antioxidant active ingredients that could reduce neuronal degeneration caused by Parkinson's. A 2010 Utah State University study concluded St. John's wort inhibits and kills Mycobacteria and other gram-positive bacteria. The root of the crawling vine Polygona multiflorum, Foti or Heshao Wu, is native to China and is an MAO-B inhibitor. Japanese researchers have shown Foti to have protective effects on nigrostriatal neurons. Foti exhibits antimicrobial properties and has been used to treat lymph node tuberculosis in China. Oxazolidinones are a class of antibiotics developed in the 1950s and are MAO inhibitors. Linezolid is prescribed to treat gram-positive bacterial infections that are resistant to other antibiotics. Linezolid efficacy has been reported in cases of nocardiosis. Unsurprisingly, linezolid has excellent activity against TB. From a 2009 European drug patent application. Oxazolidinones were originally developed as MAO inhibitors for treatment of depression and Parkinson's disease. From 1971, oxazolidinone and a potentiating agent to treat Parkinson's disease. Curcumin is a component of the spice turmeric and is an MAOA inhibitor. There are two types of MAO inhibitors, MAOA and MAOB. MAOA and MAOB inhibitors should not be taken simultaneously at pharmacologically active doses. Taking large doses of each may cause the cheese effect. After eating foods such as hard cheese or anything aged or fermented like wine, tyramine is released and thus causes a spike in blood pressure. Curcumin enhances killing of M. tuberculosis by modulating macrophages, a type of white blood cell that ingests foreign material through the induction of apoptosis, planned cell death, and autophagy. Cells self-degrade and essentially cells eat themselves. Piperine, the alkaloid in black and long peppers, is a mixed MAO inhibitor. It partially inhibits both MAOA and MAOB. Piperine was tested with rifampicin-resistant Mycobacterium tuberculosis, and researchers concluded piperine may be useful in augmenting the antimycobacterial activity of rifampicin in a clinical setting. Moreover, piperine effectively enhanced the bactericidal activity of rifampicin in time-kill studies, and also significantly extended its post-antibiotic effect. The ethyl acetate fraction of Piper nigrum leaf has potential activity against Mycobacterium tuberculosis. The antimycobacterial activity of the fraction might be through the disruption of the cell wall of Mycobacteria. The ethyl acetate fraction of Piper nigrum leaf reduced the colony-forming unit ability of Mycobacterium tuberculosis by over 98%. Indian scientists have combined the TB drug rifampicin with 10 milligrams of piperine. The new drug is called Rhizarine, and it reduces rifampicin's dosage from 450 to 200 milligrams and shortens the treatment time for TB patients. Mucuna pruriens, the velvet bean, has antimicrobial properties and is used to treat tuberculosis in Ayurvedic medicine. As previously stated, Mucuna pruriens is composed of nicotine, 5-HTP, the precursor of serotonin, and alkaloids. One of the alkaloids present is beta-carboline. Beta-carboline has antimycobacterial activity and is selective towards the Mycobacterium complex. The author concluded beta-carboline is a lead candidate for a potential new TB drug. With an additional internet search, I found a patent application featuring an antimycobacterial drug composed of carboline. In a pharmacological review of Mucuna pruriens in Parkinson's disease, Mayer and Davis and Rusher demonstrated neuroprotective effect of beta-carboline. Beta-carboline reversibly inhibits both MAOA and MAOB. Inhibition of MAO enzymes by coffee, and the presence of MAO inhibitors that are also neuroactive, such as beta-carbolines, might play a role in the neuroactive actions, including a purported neuroprotection associated with coffee consumption. Dr. Broxmeyer references the 1987 Datatop study in which the MAO inhibitor Depronel was tested on Parkinson's patients, and the LA Times science reporter Thomas H. Ma II states, a nationwide clinical trial of a new drug therapy for Parkinson's disease has been stopped early, so that researchers can begin giving the drug, which has striking beneficial effects, to all 800 subjects in the trial. It might be considered a fluke that Depronel, a Parkinson's mainstay, comes from a class of drugs, the MAO inhibitors, originally designed to cure tuberculosis.